Hi everyone, my name is Meghan Nesom and this is my Health Education and Promotion Philosophy presentation. My health education philosophy falls under that of equality. Everyone should have access to the same information and resources. Health education is not a privilege, but it is a right for everyone. Ideally, we would be able to reach lower socioeconomic communities the same as we are able to reach higher socioeconomic communities, and provide them with the same information and access to healthcare. Healthcare is, in fact, a human right. There are numerous variables that are the dividing factors to equitable healthcare, including education level, socioeconomic status, and citizenship status. So a little bit about my background. I've worked as a nurse in a level 1 trauma center at a tertiary care facility in the South Broward County area. And I used to believe that families were negligent for putting their children in what I saw as harm's way, when in fact it really was a miss in an education opportunity for healthcare providers. I have learned in my almost 10 years there that everyone in the community wants to keep their loved ones safe and healthy. And injury prevention should not be limited based on socioeconomic or education status, but should be made available to all. Healthcare, yet again, is a right that should be attainable for everyone, regardless of their standings. The education or lack of education level in America is a huge component to health. The National Institute of Health recommends that all healthcare material that's handed out to patients and families be written at an 8th grade level. But with that being said, half of all Americans read only at, if not below, a 6th grade reading level, and 20% of this population has what they call literacy level of 1, which means they struggle with basic vocabulary and sentence structure. This is not even taking into account people who use English as their second language and their lack of ability to translate health information that we give them. After education, we move into the socioeconomic status of Americans. A low socioeconomic status is actually considered a major health determinant. We have an increased risk of avoidable hospital admissions that are associated with that. Lower socioeconomic status is associated with a higher disease burden. And low socioeconomic status is also linked to an increased risk of premature mortality. Greater wealth has been and will continue to be tied to greater health. The next thing that's tied into healthcare is somebody's citizenship standing. So 1 in 10 people aged 15 to 49 are considered non-citizen immigrants. So these are people that hold visas or green cards. They have a temporary protected status, and they are fallen what is called out of status. So their visas have expired, or they've entered the country illegally, or they've been granted deferred enforcement of deportation, such as those provided for the DACA law, right? So the deferred action for childhood arrivals. And out of those 1 in 10 people, half of them are uninsured. So that's roughly 8 million people to speak of are completely uninsured. So with that being said, if there was an emergency, they could enter an emergency room and be treated under an EMTALA law, which states that we will stabilize you and then that's it. So you come in sick as can be as a trauma, let's say, we'll treat you under our trauma protocol, and then when it's time for discharge, we send you on your way. Now you have no way to do follow-ups, no way to seek physical therapy, occupational therapy, enter into a rehab, anything of that. So your care literally stops after you're stabilized. With this, now 1 in 5 non-citizens have not seen a healthcare provider in the last year. And out of our undocumented immigrants, roughly 60% of them lack any kind of healthcare coverage. So these people are just left to either access free and reduced clinics, or they just go without. So in conclusion, the utmost importance in health education is remembering that no two humans are the same. No two bodies can do the same thing. But in fact, all bodies are capable. It is important to meet the human where they are in the current stage of life. Also, it is important to remember that knowledge that is not accessible to all should be deemed as a huge miss in the healthcare setting. Humans want to do what is right by and for their family. By figuring out how to reach all humans, regardless of their educational level, socioeconomic status, or current citizenship standing, should be our priority for all those that are in the healthcare field. These are all the references I used throughout my research for this project. There were far more than what was requested, but it required all this information to be found in order to give a complete look of where we are truly missing in the health education for the average American.